What people don't realize is your vitamins affect your entire body. They are like a spark plug. You don't really ever think of your spark plug. And if it's working perfectly, you don't think about it. And if it's working like a little bit well, you don't really think about it as long as the engine runs. But the minute your spark plug doesn't work, the entire engine shuts down. It is such a small piece that you never think about. And vitamins are the same. You can have them working really well or kind of well, and your engine might run. But the minute they really turn off, your entire engine is going to shut down. And that's a problem. And I see deficiencies in everybody.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Dizer. Please remember that the following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Dizer, and today I'm speaking with Dr. Marko Lujic, a physician whose journey has taken him from the precision of the operating room to the forefront of preventative and longevity medicine. Dr. Lujic began his career as a general surgeon, but through witnessing the journeys of his patients, he recognized the limitations of waiting until illness demands intervention. That realization led him to establish RTS Health, where his focus is now on hormone optimization, personalized prevention, and empowering everyday people to access the highest level of care. In our conversation, we explore what it takes to make a bold career transition, the philosophy behind "you are not an algorithm," and how biomarker-driven care can transform health outcomes. We also discuss his mission to help everyone achieve their optimal, his partnership with Vitamin Lab to deliver custom formulations, and the ripple effects that better health creates in family, work, and community life. It's an inspiring discussion about medicine, mindset, and the future of personalized care. Let's get started. Welcome back to Personalized. I'm your host, Dr. David Dizer, and I'm here with Dr. Marko Lujic. Nice to see you, sir. How are you doing today?
I'm doing well. Thanks for having me, David.
Oh, you're welcome. I'm happy to speak with you. You've got such an interesting history going from general surgery into this fun realm, this realm of personalized care. I would love to hear about that transition, that what most would call kind of a bold move from intervention to preventative care. Can you tell me about your journey a little bit?
Yeah, so I started out, in my medical career, always knowing as a kid I kind of wanted to get into the medical field of some sort. I didn't know exactly where that would take me. College happened, then I went to med school, that happened, and then at the end I decided that general surgery at that time was going to be the best for me. So I did residency and became an attending general surgeon, practicing, very busy. It was a wonderful experience in terms of the technical end of it. I didn't feel fully satisfied with my ability to help people. And as kind of altruistic or whatever we want to look at it as, I wanted to be able to say to myself, like, okay, I'm doing the best I can do for whoever I'm encountering. And general surgery, I just didn't feel like offered me that option. So I started looking into the preventative care world, holistic, naturopathic, primary care, and modern medical, and kind of put all this stuff together and learned that there was definitely an option to intervene before illnesses got to the point where they needed hospital intervention. And the best way to do that was a hybrid model that I thought. So medically, Western knowledge of pharmaceuticals and the capabilities of the technology we have, mixed with a more Eastern style, potentially holistic naturopathic approach to medicine in terms of viewing the human as the whole. And with those two skill sets, put it together and hybrid approach somebody's healthcare. But the overriding thing to me was, how do you fulfill that per human? Because I was raised in a medical world where it was like algorithm. Okay. Yeah. 42-year-old male gets this, 43-year-old female gets this. And part of that was how we customize the hormones, the vitamins, and everything involved in that care then became part of my arena. So it wasn't just, okay, I'm going to take a knife and fix something that's broken. It was, how many variables can I control that are within our ability to control to make a health outcome better? And so far, I'm really glad I made the change. I was told by many doctors in my arena, outside of my arena at the time, like, oh, don't do that. You're never going to be able to make a living off that. You're wasting your education. And inherent in when a doctor said to me, you're wasting your education, when I explained to them I want to go deliver healthcare, that made me 100% guaranteed to myself that I'm doing the right thing.
Love that. Love it. I never heard anyone say it like that. Do you feel like it's been the right thing for you?
So not only been the right thing, but truly rewarding. I, without a question, as a surgeon, used to love the technical win. Meaning, like, was this person's body so damaged that I can't overcome those obstacles? And when you do that, that's a really satisfying thing. But it's almost me versus them, rather than me with them versus a disease. And on this side of the preventative care, it's always myself, the client, versus whatever we're going against. So we're on the same side. We're never fighting each other. We all have the same goals. And in terms of being rewarding, there's really nothing better, I think, than finding somebody who thinks they're doing pretty well, right? Like, they're like, oh no, I got everything going. There's not going to be much, and let's take a look. And then you find a lot of things you can tweak, right? Minor adjustments that have major benefit on the back end. And that to me has, I think, been the most satisfying part.
Let's take that avatar. Let's take that person who feels like they're doing a ton of good things. Maybe they are, but you find a few things that could be adjusted. What might some of those examples be?
The best example for this is like that middle-aged, say 45 to 55-year-old female. They are really into their health, right? So they're conscious of their eating and they go exercise all the time. And when they go exercise, they do group fitness, high intensity. I go 4 to 5 times a week and I really put in all my effort. And that's, from an outsider's point of view, like really good, right? That's a huge advantage. That person's giving a ton of time to their exercise. And they are, and they're doing really well with what they can do. But then those people come in and we do, say, a set of labs and we get all of their biomarkers identified. And what we see in a lot of these people is effort-wise, they're being driven by this social norm in the United States, especially where more is better, right? So instead of exercising once a week, I go 5. Instead of getting my heart rate up to 100, I get it up to 250. Instead of sweating for a minute, I sweat for 5 hours, and more is better, and more is better. But in that age range, and I picked that particularly because it's the most glaring example, when you then go in and look at their biomarkers, doing more is actually harming them. They're usually underfed. They don't have enough carbs or calories or protein in their diet to support the muscle that they're trying to build or even maintain the stuff they have. They're over-exercising. They're overdoing it and being catabolic and breaking down with poor sleep, poor recovery, and they end up on this kind of spiral of events. The biggest thing I find in these people is when you do get a piece of data and prove that to them, those slight changes where they were stuck and they're like, well, I'm doing that 5 days a week and I can't get rid of this little bit of fat, or I'm not able to finish that 13-mile run. When we kind of dial it back, reestablish a foundation, check on the inside what's going on to match what's going on the outside, the benefits in doing that are so profound that these women then start gaining muscle, their endurance, cardiovascular fitness, and all these things get better because you can cater their nutrition, exercise, and medicine to best suit their specific body type with biomarkers rather than that demographic.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Right. That's a great example. You've got a unique perspective here because you've worked with people on kind of both ends, on the disease end and on this kind of optimization, preventative end. What's the difference working with these two kind of different groups of patients? We could say, well, what have you noticed is, I don't know if it's challenges or what's it like working? How are they different?
Yeah, in hospital medicine, most of the time you get someone when they're in pain, right? So they're at a point in their life where they need to come see somebody that is potentially going to perform an operation, meaning you're going to go to sleep and have a physical cut and a physical alteration to your body performed. So those people are usually really stressed, high anxiety, not very trusting, right? They're very questioning of what's happening because they've been led to this point where why would they need this if they weren't led to this point? And then it's a relatively involuntary interaction because they're always there because they have to be. There's rarely a time where somebody goes to a surgeon, at least the world I was in, and is like, hey, I want to have this done. Like nobody really wants surgery. So that version of a person is very different to interact with than somebody who is seeking health, who might be unhealthy and might have gotten to that like wit's end, but now they're voluntarily taking themselves somewhere to get better. They're not going to fix something that already broke. They're like, I don't want it to wait till it breaks. Let's try to get in front of this. Then you also have the crowd that is overly voluntarily involved with their health, which is clear as day, doing everything they can, trying their hardest, and they want to come cross their T's, dot their I's, and really refine it. But the major barrier between those two is voluntary entry into the system versus involuntary entry. And as we know, humans, whether compliant or not, based on voluntarily doing something versus involuntarily, have a very different threshold for patience, threshold for education, threshold for interaction on a nice, calm manner, right? So you get people super stressed, involuntary, they're not going to be in a great mood versus people that are here to really try to do better. And I think that's the glaring difference. Like one is a very optimistic thought and approach to being involved with medicine, and the other is a relatively pessimistic, I just hope this doesn't go the wrong way.
Yeah, good point. It's making me reflect on all the times that wives sent their husbands to me who are like involuntarily there and how much more challenging that is.
Yeah, right.
It's way different.
You have to convince them that what they're doing is good. That's already the hard part. And then once you convince them of that, then you got to try to show them the right thing to do beyond that, which is already difficult because they're on the defense.
Yes, that's right. Yeah, that's a great point. Where do we start? So, we say, okay, person's not an algorithm. They're coming to you for personalized care. And I know that after checking out all of your materials, you've got a really cool kind of framework for taking people along this journey. Maybe you want to share with me either where you think it starts, if that part is personalized, or how the journey goes.
Yeah, I think where it starts is a big deal, right? Because I'm a personality myself. So I need to be able to work with whoever's sitting in my office. So that initial barrier to entry is personality driven. Like, do we get along? Are we going to be able to communicate? Usually once past that, on the client's end of it, do they want to work with me? That's up to them. And from my end of it, a little bit of what's really nice in this healthcare arena too is that I sometimes get to choose also, because there are a lot of people that come in here with the intent just to purchase, right? So it's a boutique style medical practice. It's a little more expensive than the average. So if they come in, they think, well, if I'm going to pay top dollar, I just get top dollar. Now, the difference in medicine versus a car sales is if you go to a car and you pay a lot of money for a top dollar car, you leave with that car, like perfectly made, and you get to do whatever you want with it. Well, medicine's a little different because it's still then beyond the purchase point, and point of sale requires investment of time from both of us. So I think that initial screening process from my side helps me to determine, is this person paying just to hopefully get what they want and tell people they're paying for something? Or are they really bought into kind of holding the line and following the blueprint that we lay out for them to become healthy? So that initial barrier, once we discover that and once we figure that out, we transition into then the program, right? And matriculation of that consists of a huge set of lab data, right? So we do mobile phlebotomy. I do not make people even leave their own home. Our mobile phlebotomist in Connecticut, who I have control over, goes to people's homes. We use a third party out of state, also same in-house lab data draws.
Mm-hmm.
That data then gets sent to a lab, and then myself and the client will meet. We take that data from the labs and we use a DEXA scan, DEXA, and it's a low energy X-ray machine, and it gives us bone density, muscle mass, visceral fat. So not the stuff you can pinch, but the stuff inside your belly around your organs.
Which you've seen before.
I've seen hands-on, lots of it. So when we take that data set of labs and the DEXA scan, and myself and the client sit down, we discuss those two pieces of data and everything included in it. And then we come up with a health plan, right? And that health plan involves exercise, nutrition, and medical optimization. That could be a number of things. It could be advice on, here are things you need to eat or not eat. Here are things you should eat at certain times a day or not certain times a day. Here's a good output in terms of exercise to caloric intake ratio. Hormone balance, right? So testosterone, estrogen, thyroid, progesterone, cortisol, aldosterone, all of their hormonal profile, endocrine profile in total, right? So not just your thyroid, but the rest of your endocrine system, all of which interacts with body fat, muscle mass. So using the DEXA scan in conjunction with that is also very important. And then I'm on this podcast and I do like to highlight it because it's a really, really, really cool thing that I love. And I'm not just saying it because I'm here. It's such a big point for our clients and for my practice that we then also deal with vitamins, right? And it is so often that vitamins have just been like thrown to this wayside where it's like, go get a multivitamin. And it actually like makes me really irritated to hear people say that, because when you are completely lacking vitamins and they're in zero mode, you feel terrible. And to willy-nilly just be like, yeah, here, take a bunch, is not to the client's advantage either. It's just a lazier approach from the practitioner. So I think it's an amazing thing here now that we offer also with that lab data, a fully personalized vitamin supplementation with everything else you need from any vitamin shop either. That is a deliverable to the person. So after that first encounter with review of their labs, their vitamins, trace elements, hormones, everything we can think of, we personalize their care. Then it becomes a yearly style phased out program. So every 3 months we do labs. Every 6 months we redo a DEXA scan so that body composition is followed closely. The every 3 months labs are not as extensive as the once a year big set, but they are also based off what is required at foundational level with adherence to certain levels that were seen on the big set that we might need to adjust. And then in this facility, because I am also inside a gym, right, like right outside my window is the gym floor, we have a VO2 max, which is a cardiovascular fitness examination. We require those once a year. An RMR, resting metabolic rate assessment, to help with people's caloric needs so that I can tell you, all right, at 100 calories a day, you should gain or lose weight, or if you're exercising, here's your maintenance caloric needs. A wavy brain scan, which gives us metabolic health of people's brains. It can help with ADD diagnosis, ADHD diagnosis. It is a measurement tool to help assess other medical ailments. And then a whole slew of other investigations we can do and help with glutathione, NAD, supplementation, and all these other things. And that becomes the program here. And the whole point of this is I want to be the physician to my clients that is the missing link of what they've been wanting, right? So what happens? You call your doctor, you never talk to your doctor, you don't know what they think. The next time you might get in might be 8 months from now. You can't really get a hold of them. You end up talking to a potential PA who is disconnected and might have their own agenda, right? The whole goal in here is it's our healthcare program. We have at least 4 touch points a year that are guaranteed, right? So it's at least 4 hours a year that you have to encounter us. You have to. I run the medical practice, right? So if it's myself, the PA, or another physician, whoever it is, we're all practicing the same style of medicine. Now, there is autonomy per user, and it's not made an algorithm because we don't put anybody in a demographic, but it is algorithmic in terms of how we think, right? Because we think preventative care. And in that teaching and that schooling, we then can approach each client as an individual, but with the same basis of thought, and give everybody their catered program. And it's a educational program. We want to empower the consumer to learn about their health so that they feel like they can make real good decisions out in the wild when we're not here to watch, right? Am I going to eat the pancake, or am I going to have the eggs? Or am I going to eat the pancake now because I know I ate my eggs this morning? And those decisions then become easier when you're not in the office, when you're not thinking, because they become a habit. Mm-hmm. And the whole goal is to develop this educational system with good habits, good lifestyle, and hopefully deliver people the ability to encounter the supermarket, encounter every day-to-day life without being nervous about what you're eating, with full control over your health, and knowing, all right, I could have a little bit of that because I don't need that. But at the end of the day, my overall health care is being taken care of.
Right. I love it. What a cool program. It's everything I ever wanted in a program, packed into one. When we were doing our pre-chat, you were talking about really wanting to help everyday people get premium care.
Yep.
Tell me a little bit more about that. I mean, what do you think obviously your program is much different than what most healthcare systems offer. But why did you say that? What drove you to that?
So it's tough for me to say this, but I do really believe this on the inside. There's not many places in the world where you go pay money to somebody, you get nothing in return, and you're okay with that, right?
Fair.
Except in the healthcare world. And no matter what we want to look at, we pay a premium into a health insurance company. And you might use that for a disaster, you might not. All you need to know is one thing. Insurance companies make a profit every single year. That means that less people use the amount of money they put in than they take out, right? So at that point in time, we know we're paying for something we're not really getting. So that really frustrated me. And that happens to everyday individuals, right? That's from zero income to $1 billion. Like, you pay for health insurance, you don't really know if you're going to get anything out of it. And more than the majority of the time, you don't. Then I wanted to somehow make it deliverable to the everyday human, right? There's a lot of these programs out there that are $250,000 a year, and they're executive programs, and the Princeton longevity, and all these other things that are super high elite functioning for CEOs and executives. Now, is that a fun arena to be in? Great. But how can I take that arena and deliver it to everybody? Cost effectively, it's a little bit more expensive. You have to buy in. You have to have skin in the game. And for me, that means interest, right? If you give something away for free, it's of no value. And we see it every day. Free stuff, no value. Put a little skin in the game, we value it. So then the price point becomes a little higher than every regular day medicine. But how do you make that a deliverable? Well, you make it affordable for the average consumer, luxury style delivery, right? With personalized care. And that's what this office shoots for. So if you are willing to prioritize some monetary budgeting towards healthcare, we will give you the luxury version of what every other kind of outfit is doing for an affordable cost. Now, is it an overall affordable if you looked at it from the perspective of paying in the health insurance and insurance doesn't cover it? It's not, right? Because it's out of pocket. But relative to the healthcare you're going to receive, this is of utmost value because you will actually get what you're paying for. And my whole goal was for the consumer that had interest, for the consumer that really wanted to be involved in their healthcare, male, female, whatever age, how can I give that to somebody who really wants to go get it? And this was the best version of how I could do that.
Love it. So cool. So cool. You talked about personalizing your vitamin therapy, for example, which I've been doing here for quite a while as well, working with Vitamin Lab and creating these protocols and seeing people feel really good afterwards. Like just, you think, okay, we have this test, it's showing deficiency, like it's going to take a while to actually notice them, but people feel pretty good pretty quickly when they find a deficiency and correct it. And, I don't know if this has been your experience, but my experience has been, it's not just B12 and iron. Like it's really not. There's so many things that can be deficient. Can you walk me through some things that you have found and corrected, and maybe tell me a little bit about some cases that you've had where you've been like, whoa, okay, they're doing good now?
Yeah. So I have a full vitamin panel on all of my clients at every visit, right? So the yearly and the every 3 months.
Wow.
The quarterlies. I do vitamin A, I do B1, 2, 3, 5, 6, 7, 9, and 10. 12. We do vitamin C, D, E, K, everything you can think of, right? And what I have found is, even when taking a multivitamin tab off the shelf, not a single human has walked in this office and had every single one of their vitamin labs even remotely close to the top 50 percentile of normal. Not even close. I do not have the exact number, and I wish I did the calculation, but my vitamin D, which 30 is the lowest end of normal, up to like 100, 100-ish, I have more than 60 or 70%, less than 50. And out of those, probably 30% of those less than 30, like in levels that are just inexcusable. Then I have a ton of what people don't realize is your vitamins affect your entire body. And I view them as an analogy. I look at everything as an analogy, and they're like a spark plug, right? And a spark plug in a car. You don't really ever think of your spark plug. And if it's working perfectly, you don't think about it. And if it's working like a little bit well, you don't really think about it, as long as the engine runs. But the minute your spark plug doesn't work, the entire engine shuts down. It is such a small piece that you never think about. And vitamins are the same. You can have them working really well or kind of well, and your engine might run. But the minute they really turn off, your entire engine is going to shut down. And that's a problem. And I see deficiencies in everybody. And the anecdotal evidence, which I don't know how to really get out there, is just like you said. The minute you make somebody's vitamins appropriately balanced, they feel better. And I don't think it's like a percentage of the time. I think it's every time, right? Like I see a response to just vitamins, aside from people complaining about oh, I don't like to take them, or it takes time to take them, or, oh, they're a little bit bigger than I thought they might be. Little things like that. But once people are actually taking them, the symptomatic response to it is significant. I see, so vitamin D across the board, and I'm in the Northeast in Connecticut, so I don't have anybody with normal vitamin Ds, even in the summers. Vitamin Cs are relatively low consistently. And then all of the B vitamins. There's not a person I have yet to see with any balance in their B vitamins whatsoever. Their thiamine, we are a very alcohol-driven community. A lot of drinkers, which then depletes a lot of their B vitamin stores. So thiamine in most of my patients is reasonable, because I don't have a ton of heavy drinkers, but in anybody who dabbles in alcohol, your B1 is always in the tank. B3 I find very difficult to get nice and high, but that's an energy-producing molecule. Very important. B5, cardiovascular health with cardiac muscle DNA repair, things like this. People don't really look at, but you want to maximize these numbers. But across the board, on consistent testing right out of the gate, nobody has any balance of vitamins whatsoever.
Yeah, it's so funny you say that. Like I've been doing these tests for a long time, and it's actually been shocking to me that we haven't had one person with perfect scores. It probably speaks to the food, people's digestive function being not optimal.
And I think it's allowed for a lot of chaos behind the scenes to go uncontrolled because nobody knows where to go to control it. Like if right now my screen went fully static and you just have no idea, and I don't tell you why it's static, I'm just like, well, we're just going to have to live with that.
Yeah.
We're going to figure out how to do this podcast with static, right?
Right.
And I think the medical community has hidden vitamins because the Western medical doctor world just says, oh, those are naturopathic. Oh, they're voodoo for some reason. I don't know. They do that because it displaces their blame and it allows vitamins to stay uncoordinatedly out of control, which then I think leads to a lot of symptoms that we just don't realize are vitamin related.
Right. Well, I think there's 2 points there. One, the first point I want to mention is that I think you just had a lot of physicians steal your spark plug analogy, including me, because I love that. That was amazing. That's so cool. I'm going to use it. And the second point is I've been teaching lab diagnostics, and part of the thing about lab diagnostics that stresses me out is the way that reference ranges are created. And like, you had mentioned about the 50th percentile and maybe implied about what's optimal. And that's way different. We can look at labs too in the sense of, we use some labs kind of in diagnosing deficiency, like I think of a ferritin score, for example, and how we kind of use that. But for most labs, we're comparing them to the people in our neighborhood, and people are not super healthy. Do you have any comments on this? Because you had spoken about conventional physicians and ignoring vitamins, but maybe it's this thing that's been just going on for decades where we're just comparing ourselves to each other, and we're just like kind of getting a little sicker and sicker and sicker. What do you think about that?
I mean, you just sparked a whole emotional response. I could talk about this for a day. It riddles me with concern and sadness to set up a group of humans to be compared to the average, right? Because like effort-based can never be held against somebody. If somebody's trying their hardest and they're doing the best they can, whatever pinnacle they get to, applause all day. So effort-based is never in question. But comparing to the average for health, which is an effort-based intervention on the practitioners outside of the arena, that is bothersome. That's like going to a professional sports game. You're the betting association. You're like, guys, nobody out there is going to score more than 4 total goals because that's just what the average of the last 30 games have been. And we're not taking bets on anything above or below 4. Like, that's a horrific way to stage an event from the outside. And doctors have been staging this event from the outside because, you know why? It's a lot easier to tell people, that's average, but that's what we want, than for you to tell people, listen, I'm trying to get you here, and it's really not working well because I'm not so good at it, but I'm going to keep trying. It's a very humbling experience.
Definitely.
Right? Because then it takes effort from the consumer, it takes effort from the provider, but it's a lot easier if I just dumb down my expectations for my clients and I give them the expectation never to feel significantly better. And that to me is the law of averages in medicine. Like mean, median, and mode should not be used in medicine. The only thing we should be striving for is the best possible outcome. Like if somebody on this planet lives to 125, that should be our goal for everybody. Not just that person was an outlier. No, like how did that person do that? How do we figure out how to use the same techniques or lifestyle adjustments? Or how did their biomarkers fare against the others? Like use them as the goal, not the average. So those ranges really bother me. And I use it. It's an everyday thing with me in here, right? Hormonally driven, cellularly driven, all of it, because everybody kind of falls into the normal range, right? But that is not optimal, and that is not where we function the best. And the sad thing is the evidence out there to adjust to optimal exists, and it's in the literature of the groups of physicians that don't use it, right? Like if you go read endocrine literature, you will see the benefit of thyroid optimization. They just don't allow it in practice because it's a lot harder to do.
Right.
If you go look at testosterone experiments, and when they had to remove testicles from younger kids with hormone replacement forced, you start to see the data in reality, but they don't it's in their literature.
Really?
Right. We just don't use it in everyday practice. And the reason we don't, I think, is one thing: we just don't have enough doctors, right? Like, I spend, every first visit is 90 minutes I spend with each person. Like, when's the last time you sat with a doctor and talked for 90 minutes? That was scheduled. Not like, oh, we ran over and the rest of my day is shot. Like, that's a 90-minute schedule. And the only way you learn about people and you can take care of their health, I believe, is to talk to them, right? So optimization of the system and who's dictating the system. If I play the law of averages and I'm like, well, David, on average, it takes me about 15 minutes to see a client. I'm going to see you for 15 minutes. On average, I can probably figure out what I need to figure out to keep you in range. So no shit, if I set my target up for a nonsense range and I give you nonsense effort based on a nonsense amount of time that I've pinned on how much I should spend with the human, right? That's across the board, male, female, kid, or adult, 12 to 17 minutes. Then I'm going to give you an average result. But if I set myself up to make that look like success, well, then that's the system we're going to live in.
Yeah, it's a great point. Now I'm inspired about your story about the testosterone, but I was also thinking about the centenarian averages, because we're getting, it's 2025 here. We've probably got 20 or 30 years of people who have lived a long time, who have done labs every couple of years. Maybe we could take a peek. I'm going to look and see if anyone has done that.
I would venture to say by the time the current 20 or so year old generation, if they really buy into this newer age of healthcare and companies like Vitamin Lab coming out with more catered vitamin supplies and doctors that want to pay attention to people that are healthy and want to become healthier, because that's always a possibility.
Right.
I think you're going to start seeing people like 100, 110. Because why? If you want to be the most humble servant of medicine you can be, you have to realize death will always win, right? We have yet to keep a human alive forever. So the minute you give the diagnosis of chronologic age, a pathologic diagnosis, you instantly hand over to the public that doctors know nothing, right? Like, you automatically say, we're going to lose every single game we play with your health. Fine. Let's admit that, actually, doctors. I really would like to admit that, because we are not God. You don't come to us and I change your life and all of a sudden recreate it. No. I'm just trying to get you from entropy happening really fast to entropy almost happening at a null event, right? But the way we do that is we have to admit to ourselves what we don't know. And it's sad that we don't, because we're okay with the average age being in the 70s for the past 30 years. COVID came at us. Now, was COVID bad? It was bad, but it stressed us so much that our average life expectancy went down. So how well prepared for disaster mitigation were we? Really not at all, right? We would be in hospitals preparing for mass casualty, plane crashes, bus crash. How about the random virus? Because every person in our hospital is a diabetic nightmare, carbohydrate disaster, fat metabolic disaster, and now we get hit with a infectious disease that changed the world's life expectancy. That alone should make you realize we have no control over healthcare, right? But the whole goal of optimization and that whole goal of a deliverable that I think is going to be more catered is achievable. It's really difficult with the amount of practitioners we have. And listen, me and you are sitting on a podcast talking about this. I tell people I use a company to make catered vitamins and they think I'm reinventing. It's crazy. They're like, oh my God, you do? But to me, it's atrocious that this isn't everybody's vitamin protocol. Does that make sense?
Completely. And I think that most people with enough exposure to this way of being, and if they had the capacity to do it, would want to do it this way. Don't you think that we could have a team of millions of people who are doing the same thing if it was financially possible, if people weren't worried about changing like you?
It would be amazing.
I mean, you you went from being a general surgeon, sir, to this journey.
The hardest part for doctors is like when you're in a hospital, there's this big thing behind you called the hospital. And they know the Bank of Yale is never going to not send you a paycheck. You're not going to show up and like the front doors are going to be locked shut, right? So leaving that world for a doctor is very, very hard because your entire life you spent trying to get into this group of people. Like, oh my God, I got to get good grades in high school so I get into pre-med in college. Oh my God, I'm fighting so hard to get into med school. Then you get in and then you're almost in the door and then residency and you're almost in the door. So you fought your whole life to try to join this real like exclusive tiny club that then is paying you to be in it. So it's hard to then be like, well, I want to try to go back out in the scary world on my own. That's a hard task.
Oh, completely. It sounds really challenging. In our pre-talk, you were saying that one thing that really motivated you was having the opportunity to spend time in health empowerment and lifestyle time and the benefits that has on the rest of the members of families. And you focused on this heavily where it's like, I could do this thing where I'm helping someone prevent diseases, but then it'll ripple into the rest of their crew. Can you tell me about that statement and maybe the impact that you're looking to have?
Yeah, and I'm really glad you brought that up because I know before we started, you're like, are there any points you really want to bring up? And this is one of them that I think is awesome. So I do believe we are a product of our environment, right? And I am on this big kick, and I've always kind of been on it like, I am the they, meaning like we always say they told me to do this, or they say this, or they say that. Who is this they? It's us, right? Like I am the environment that I create. So I understand we are created by our environment and it's nice to blame environment. And I did my master's in public health and I know the whole pyramid scheme and we need to adjust our surroundings to make ourselves either successful or not, depending on what's around us. But we make our environment too. And my whole push in here is if I can build people that are strong enough to be so confident in themselves that maybe that single being can influence enough around them to adjust or send a shockwave through the environment immediately around them to then make the environment adjust to them. Now, I would be very weary of that slippery slope if I was sending people out to the world with a bad message, because that's not what I'm looking for. I'm not looking to start trouble. But there's no way to argue with a message of health. So I know that anybody I send out here, even if it's in an egomaniacal way, and they're like, oh, look at my muscles, I know behind the scenes I'm creating a healthy person. So whatever environment they're going to promote that version of life, meaning I go to the gym, I'm conscious of what I eat. Oh my God, I feel so good. I'm doing this medical style approach to my life now. It can help spread the word. And when I start to see these people engaging with their communities, they do change it. So much so that now around us here, there's almost this like momentum built up with RTS Health where I've started getting people that come in and are like, well, I'm here because like I feel like I should be. You know, does that make sense?
Oh, okay. This is good.
Now for me, it's a little scary because you don't want people just going places because they feel like they should be there.
Yeah.
But I love it because I know I'm about to potentially help them become an even better version. Like there's no arguing with health, but that environment we're building, I think, is really cool. And then when you send somebody out, I mean, I know I can only use it as an example for me, but I catch my kids constantly. We'll be in public and my children will be like, oh, that's not healthy, or I want protein, or they make comments that I know they're watching.
Yeah.
Or like my son will make fun of me, you know, like as if he's bicep curls but that's okay because I'd rather him do that in jest than like, oh, daddy's drinking a ton of beers or something, right? Like,
Yeah, completely.
I feel like that's a better contributor to society. So the more we can push people to feel really good about themselves, physically, I think their mental well-being gets better, their confidence. They start spreading the word of how their confidence built through health through foundational medicine. And I think we just build a better community around us.
I would agree. Okay, this is really well framed. That's really great. And I'm glad I'm so glad your kids are into it too. My kids, I've been making them listen to Jocko. And so the other day I had two experiences last week where one child came up to me and she goes, "Hey dad, every second counts."
Yeah.
And I was like, yes.
Yes.
That's amazing.
That's when you know you did the right thing.
That's when and then another one came up and she goes, "Dad, if you're thinking about doing it, just go do it."
Love it.
Okay, love it.
You made progress. Now you know you won.
Yeah, just a week of listening to the Jocko tapes, and that's what we're getting. It's great. Environment's so important, around not just mental, emotional environment, but nutrition environment, exercise environment. We've got the track and field world championships going on right now, so I'm trying to get them to watch that.
Yeah.
But you're in this fitness facility, and that's always been a dream of mine. So I'm trying to build a practice around working with these type of facilities. What's it been like being in the culture and doing your thing in a facility like this? Founding one. I know you founded founding one.
But that's the gym floor.
Love it.
And what's amazing to me that I love is at a hospital, I was always just around illness.
Mm.
And I am so grateful for hospitals, right? I can never be misconstrued or misspoken for misquoted being. Hospitals are a necessity. I am grateful we can do what we can do. My whole drive is how do we keep people out of them so that we don't overuse the sick system. So with that being said, being in a facility now where people are coming in and engaging voluntarily with lifting and exercise and medicine, it's such a different mentality or mental approach to medical care because nobody really walks in here sick, right?
Mm-hmm.
Or they walk in, maybe they're not feeling well, and maybe they're not doing the best that they think they can do,
Mm-hmm.
but they're not in here for like a terminal intervention that we need anesthesia or we need to really discuss end of life care just yet, things like that, right? So all of the environmental cues are usually with a positive outcome. So it's like positive reinforcement to doing things that are going to give you more health. And that's a fun thing for me. Whereas in the hospital, I might be doing an operation for somebody, which is saving them from being ill that day or dying. But unfortunately, sometimes I'm actually positively reinforcing a negative health aspect, right? Because a lot of these people, for instance, I would have like a diabetic who really didn't care much about exercise, overweight, and needed their gallbladder out. And I vividly remember a conversation with one individual in my office after that visit, after the hospital came to the post-op visit. I was like, hey, from here out, we really got to get our act together. We got to start eating healthy. That person was like, I'm not here for a lecture on what I should do out, right? Like, no problem. Have a good day.
Mm.
But that reinforced to me, like, I want to engage with people that want to engage with me about that sort of thing. But in here, if somebody comes into the office and they are in a little bit of a health downer or maybe not feeling well, 99% of the time, everything we do is going to reinforce them getting to a better place. So that, to me, was really, really satisfying.
Oh, completely. It makes me think of one of these questions I wanted to ask you about redesigning the healthcare system. Because, you speak about someone who they weren't there for that. They weren't there for that kind of chat. But it's the most important next chat. Yeah. How do we design a healthcare system if we could, given your expertise and your master's degree, how could we design one that kind of did all of this?
Yeah. So there's going to be aspects of what I'm going to say that are potentially private sector, public sector intervention. I have a combination in my mind. Number one, I think there needs to be accountability from the user way more than we give, right? So at some point, we need to just be able to say to people, listen, you have diabetes. Here is the solution. We know I'm using this as an example. We know your lifestyle, your finances, everything. This is not going to be a burden on your bank account. This is not going to be a burden on your lifestyle. You just have to do A, B, and C, which are well within the reason here. And then if your diabetes remains and you don't do that, at some point we got to figure out, like, you either need to pay or not, right? So a private sector combo where a little bit of accountability is on the consumer. Now, if that consumer wants to be involved in the medical system, they should be allowed full access to everything. So I do believe a health insurance style with a premium is a necessity. But I don't have the perfect solution, but I do not understand premium and deductible. I just don't get it. Like, if you have a fixed number of humans in a system and you have a run rate now of 20, 30, 40 years on average per capita, like, there's no reason we can't write a budget out that works for healthcare. Like, it's within a couple $1 million. Like, I don't know. Like, to me, that seems, we only have 260 million people in our country or something about now, like, per capita. If you can't figure expenditure for healthcare, well, then I don't trust you with finances either, but that's a different story. So I think there needs to be some baseline insurance that's provided for everybody, but that baseline needs to be used for preventative care, and you get credit for that. And then there's an emergency slush fund, right? Like, there are going to be the car accidents. There are going to be the cancers you don't see coming. There are going to be the heart attacks that no matter what you do, you don't see coming. And that disaster rainy day fund is easily accounted for based on numbers, I think, because I've seen the behind the scenes numbers. But the perfect system for me is a balance of accountability on the consumer with a fulfillment guarantee on the provider. So if I was to recreate the system, I would do it exactly as I am now. I would love to reverse build practitioner, volume, move, practitioner, volume, move, so that every practitioner has the right amount of time with the right amount of people to give them the best that they deserve, that the practitioner's not overwhelmed, and exchange of capital is worth it on the front end because it's going to save the system billions on the back end. And our intervention in terms of preventive care need to be heavy. We have to get involved in people getting in gyms. We have to have movement-based protocols. Part of the accountability from the consumer means, listen, as harsh as this sounds, but like, if you've shown us no effort in terms of your healthcare, then maybe you get X, right? How can you say you've put in a huge amount of effort and not had an outcome, right? Like, we have to have some exchange. And then our biggest issue, I believe, in our healthcare system is education, which is what I'm trying to do. If you come meet with me in my office, my entire goal is how do I empower David so that he makes the right decisions? And I use data. I can help you make the right choices. I can help you know what a macronutrient is, help you learn what vitamins and why they're important so that you don't just poo-poo that as nothing, right? And empower the user, because really at the end of the day, I think in terms of saving humanity, because we're in a fucking, wherever we are in the world, I don't really know. It's just a little bit scary what's going on with people just like reacting emotionally to everything. All people want to do is feel valuable, I think. And everybody wants to feel valuable, no matter what it is. If you're the person that cleans up leaves on the side of the sidewalk, you want to know that that leaf made somebody else's day better. And that's really what people are all about. And I think if you educate and empower the human to actually have control over their health, they will. And we've stripped them of that. We've essentially said to people, here, buy insurance and we'll keep you healthy. But we've failed to do that because we haven't intervened preventively, and we've made them think that stitching your head back on after you get in the car accident was worth your insurance price, but it wasn't, right? Because you should have potentially never gotten to that point, or you should potentially never need the surgery, or you should be getting interventional care before you end up in a situation where you're sick. So I think education, access to preventive care, consumer accountability, I think, is a big deal. And then as doctors, the last thing I will say, you have to lead by an example, right? If I live the life I'm trying to tell somebody else to do, they are more than likely going to follow along. And what does that mean? I am not some like perfect human. I don't like walk down the road in a straight line. Sometimes my ankles hurt. Sometimes I might eat something that's not perfect. Yes. But I do wake up every morning and exercise. I do take my vitamins. I do try to eat as healthy as I can with the options available to me. I try to go to bed as early as I can, depending on my availability of schedule, and I try to sleep in a colder room. I try to wake up at a specific time. Like, I'm trying my best as a user, and if I show people that, maybe they'll do their best too. And I think as doctors, we are terrible. Like, we used to go to hospital events and it would be like an open bar. Like, what are we doing? Right? Like, how does that translate into a trustworthy cause? So I think to really make and manufacture a system that's going to be good, you need good leaders, consumer accountability, physician fulfillment accountability, a system that's actually going to deliver what they say, and a better education all around for the consumer end of it to know what the hell they're getting themselves into, because health is a profession.
It sounds perfect. I love it. Really well said and well organized. Thank you so much for highlighting all those points. I agree with all of them.
Thank you.
I think it's really cool and possible too. So I really appreciate that. Listen, I had a great time chatting with you today, Marko. It was awesome. I really appreciate all your points, your analogies, the way that you think about things. And I'm really happy with all the things that you were able to express today. It was really cool. So thank you so much. Where can people find out more about you? Where can patients find you?
So the easiest is our website is www.rtsct.com. I am on the internet as well on Instagram under, you can just look up Marko Lujic, but Lujic at RTS Health. If you look up any of those, you'll find me on there. We have a podcast. We have a slew of information on the internet, on social media. And our whole goal is to educate and kind of get the word out there. And thank you for having me. It's really a pleasure. And I really love working with Vitamin Lab and kind of everything you guys are doing. You know, this is not a paid relationship. This is all voluntarily done, and really can't express enough gratitude for you having me on here.
Thanks so much, sir. I really appreciate your time, and I hope to speak with you again soon, and keep up the good work. Let's keep it going.
Appreciate it, David.
We'll talk soon. See you.
Yep.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.